Okay, Russell, so just before we get started, do you want to give me a little bit of a summary of Mr. Jacobs before we go and see him?
Yeah, well, the patient's chart reports that the patient had his surgery yesterday. The op notes say he was able to begin mobilizing today with weight bearing as tolerated.
Yeah, good.
And I can see that they were only managing 200 meters, walking 200 meters prior to the surgery.
Yeah, okay, so didn't have very good exercise tolerance then?
No.
So just need to clarify a few things. Did you check the pre-op status? Do you know what he was like in terms of his knee function before the surgery?
Well, I had a look at the pre-op assessment and nothing really jumped out.
Nothing stood out to you?
No.
So did they have any, fixed flexion deformities or loss of range or anything like that?
Yeah, but I figured that the surgery would have sorted that out now, so...
Yeah, okay, so we'd expect that, they've had their knee replaced so that their joint might be operating a little bit more efficiently or effectively, but do you think that there would be any other structures that might be affected by someone who might have had a fixed flexion deformity for a while?
With the surgery, I'm not sure. I don't really think so. No.
Okay, all right. Well, we'll maybe we'll address that a little bit later after we've seen Mr. Jacobs. What about the anaesthetic? What sort of anaesthetic did Mr. Jacobs have?
Let's see. Yeah, they said he had they used a nerve block.
All right. Yep. So did you actually check the op notes, or you didn't actually look at them?
Well, it's just kind of post-op protocol, isn't it?
Oh yeah. So yeah, I understand that it can sometimes be post-op protocols or set, but it's important because you can get information like what sort of anaesthetic they had, and you said that he's had a nerve block. So why might that be important to know about?
Well, they may have had some sensory loss. They won't feel pain as much.
Yeah. Okay. So so they might have some sensory loss. Is there any other sort of changes that you might affect that maybe a nerve block might?
I remember discussing this.
Yeah.
But I can't really. I can't really remember.
Yeah. Right.
Yeah.
Okay, so sometimes they might have some strength changes as well. It's going to affect sensory, but it also might, affect motor as well. So I want you to think about that when we go in and do the patient assessment.
Cool.
So is there anything else that you wanted to look at before we move on, or is there any other information that's important?
No, I think we're good to go see the patient. Yeah.
Covered everything. So do you think we'd maybe want to check the X-rays or something before we go and see him?
Yeah, okay, it's probably a good idea to check the X-rays and Okay,
I think that would be a good idea. So let's go have a look at the X-rays.
Okay, let's go, Peter.
Okay, so looking at the X-ray, Russell, tell me what you can see.
Well, you can see that the knee joint looks pretty messed up. His other knee looks good though.
Okay, so first things first. So before we even start looking at the joint, what do we need to look for on an X-ray?
Patient details.
Good, yeah. So have we got the right patient?
Yeah, Mr. Jacobs.
Yep. So Mr. Jacobs, same date of birth, because there might be a lot of Mr. Jacobs in the system.
Good. Same date of birth.
Yep. Okay, so we've got the right knee, which is good. Okay, so is this film that we're looking at, is this before his surgery or after his surgery?
This one says it's prior to his surgery.
Yeah. What else would give it away, do you think?
I suppose the changes from surgery.
Yeah, so there's no prosthesis in the film, so that's important. So you need to make sure you go through these things systematically. So we know we've got the right person.
Yep.
We know we've dated the X-ray so that we know that it's prior to surgery. So you said to me it looks a little bit messed up. So talk to me a little bit more in professional terms there. Like, what do you mean by messed up?
Well, like this one doesn't look like the other one. The joint's smaller.
Yep.
I don't really know how to describe it.
Yeah. So the space in between the two, the femur and the tibia, that space seems a bit narrower on the affected side.
Yeah.
Good. Okay. So probably need to have a bit of a rethink about how you go through X-rays. So there's a bit more detail in there, but we can have a little bit of a look at that afterwards.
Okay.
But in terms of moving on, are you happy for us to go in and see the patient?
Yeah. I think I have all the information I need.
Okay. All right. So before we see the patient, is there anything we need to look at?
Yeah, we should probably have a look at their OBS chart before we see them.
Yeah, good. Yeah. So let's go grab their OBS chart and then we'll go talk to Mr. Jacobs.
All right.
Okay, so Russell, just take me through the OBS there. What are you seeing?
Well, yeah, his OBS look good. Seems to have had a regular pain relief from his medication chart.
Mm-hmm. So is there anything else in his OBS that are important, do you think? Is there anything standing out there to you?
Not currently, no.
Yeah. What about his blood pressure? What's his blood pressure at the moment?
105/62.
Is that, what is that high? Is that low? Is that normal?
A little on the low side.
Yeah, so it's a little on the low side. So is it something we should be worried about?
No. I don't know.
Yeah.
No, not really.
So in terms of before we get him up, is there anything you'd maybe want to ask the patient to see if?
Like ask if he's kind of dizzy or something. Yeah.
Yeah, good.
Yeah.
So the blood pressure might be a little bit low. It might be normal for him. It might be fine for him, but we probably want to check that.
It's not too low.
Yeah. But we still probably want to check that. Is there anything that you could maybe explain why his blood pressure might be a little bit low?
No. Nah.
No, that's fine then. Okay. Well, is there anything else that you wanted to do before we get him up? Before we go talk to him?
No. I think we're good to go.
Think you've got all the information you need?
Yeah, I think so.
Yep. All right. Well, do you want to start your subjective examination with Mr. Jacobs then?
Yep. Sure thing.
Right. Go.
Mr. Jacobs.
Yeah, it's me.
How you doing today, mate?
Yeah, not bad. A little bit groggy.
Yeah. How's the knee?
Oh, yeah, it's a little bit sore. It's okay.
Yeah. Okay. Is any pain at the moment?
Oh, yeah, some.
Some pain? Alright, well, if you were to put it on a scale, from like 0 to 10, with 0 being like no pain and 10 being like the worst kind of pain you can imagine, where would you rate it?
About 3.
Out of 3? Yeah. Okay, sweet. Cool. And whereabouts is the pain?
Oh, around the knee.
Yeah. Alright, whereabouts around the knee?
Oh, a bit behind the knee and just below it.
Behind it? Yeah. Okay. Yeah. Cool. And like around your leg, like any numbness or pins and needles?
Oh, no, I had a bit of numbness in the knee there last night, but it's not there now.
Cool. And it says here you only used to be able to walk like 200 meters prior to coming in. Is that
That's
true?
right, yeah.
Why do you think that was?
Oh, because of the knee. Because of the knee.
Yeah. All right.
It wouldn't permit me to go any further than that, and the pain was so severe I couldn't walk any further.
All right. Well, whereabouts do you live, Mr. Jacobs?
Where do I live?
Yeah. Yeah. Whereabouts do you live?
I live at Canungra.
Canungra? Do you have any like stairs at your house?
Oh, yeah, there's some steps at the front and the back of the house.
Yeah.
About 6 each side.
6? Yeah. Sweet. So let's have a look at that knee.
Hey? Yeah, sure, Russell.
There you go.
Yeah, it feels okay.
Feels alright? That's good. Well, there's doesn't seem to be too much swelling or redness, which is good.
No.
I'm just going to give it a bit of a feel, just to
sure.
Just see if there's any warmth. Alright. Yeah, well, there's a bit of warmth there, but that's all.
Yeah, it feels a bit warm.
Yeah. Okay.
I suppose that's normal, is it?
After surgery, yeah, I guess. So have you been putting any ice on it?
Yeah, I had some ice on it a little while ago.
Yeah?
Yeah.
Okay, that's good. Well, now we're just going to put you through some movements just to see how the kind of knee's working.
Sure.
Just get that off there. Can you start by just kind of like moving your feet around in circles? Okay. And wiggle your toes.
Right, yeah,
Okay.
I can do that.
You can do that? All right. Yeah. Okay, so what I'm going to do now, can I get you to, I'm just going to hold my hand there. I just need you to push your knee down onto the bed.
Yeah,
Yeah.
okay.
Okay, yeah, cool.
Yeah.
All right.
Little bit of tightness at the back there.
Bit of tightness. Okay. Okay. Any pain with any of those movements?
Not really, Russell.
No pain. All right, that's good. All right, what I'll get you to do now is I just need you to kind of like squeeze your bottom together.
Squeeze my bottom together.
Yeah. Is that all right? Yeah, you can do that.
Yeah.
Okay.
No problem.
I'll just yeah. All right. Well, let's try and bend your knee together first. All right.
Okay,
So
Russell.
I'm just gonna put my hand under here and just kind of under your knee there. How's that? That's not causing you any pain?
No, not so far.
All right. We're just gonna try and bend your knee up.
Yeah.
Yep.
Oh, starting to feel that now.
Yeah. We're gonna try and push it a little bit further.
Oh. Oh. Oh no, that's too painful, Russell. Too painful, mate.
Are you sure you can't just go a little bit further?
No, I can't. No, that's too painful.
I understand that it's probably a bit painful, but we need to stretch the muscle out.
Yeah, I can appreciate that, mate. But gee, that's.
We've given you all the pain relief that we can, but without stretching the muscle out, then we're not going to make any progress. We need to do this 10 times, and then we can move forward.
10 times.
Yeah. It'll help.
Yeah. All right.
Okay.
All right. Oh. God, that hurts. Oh, that's it, Russell. I can't do any more, mate. I can't do
Need to do one more.
No, I can't. I can't, honestly. It's just too painful for me.
Okay, so Mr. Jacobs, we're gonna get you to stand up.
Stand up.
Those walking exercises. Yeah.
Am I allowed to do that? Is it too soon after surgery to be standing up?
No, it'll be fine. What I'll do though, I'll go get my educator, and I'll get a frame. And
Yeah. Okay, Russell. Yeah, a little bit nervous about it.
We'll see what we can do.
All right. What have you got there, Russell?
This is it's a walking frame.
Intriguing piece of equipment, mate.
Yeah.
So, Mr. Jacobs, my name's Mark. I'm one of the physiotherapists here, so I'm just going to be helping Russell out today to get you up and
Okay,
walking.
Mark. Yeah, I think you might need it.
Yeah, no problems. Now, just before we go, can you just let me know, have you done all your sensation and strength tests? And you're happy to get up?
Yeah. They're all done. They're all
Okay.
done.
Good.
Good to go.
Oh, yeah,
Yep.
if you say so, Russell.
All right.
Okay, so just before we go, just have a look around and just make sure you've got everything organised before we stand up.
Yeah. Okay. Well, we've got our frame. Yeah, bed's a good level. Yeah.
Okay.
Yeah, I think we're all right.
What about the catheter and the socks?
Yeah.
So
Probably get those.
Yep. So we might take this
Sorry,
over
we'll
your
take
side
these
of the
socks
We
bed.
need those off, do we, Russell?
Yeah.
Just going to lift this leg up for you. That's it. Do you want to take that round over to your
Oh,
side?
yeah.
Yep.
Sorry, mate.
That's some uses.
Yeah.
So
Hopefully
I
they
don't know,
won't.
we'll just go over the top of the leg.
Over
That's
the
fine.
top? Yeah.
Over the
Okay.
top's fine. That's it. Just put it up this end of the bed as well, just
This
so that
end?
when we swing our legs off, we're not going to get tangled up.
Oh, okay. Yep. And the sock. Yep. Yep. Sorry, mate. There we go. Okay.
Right.
I think
so
we're
you
good.
ready to go?
I think
Okay.
we're good.
So, and you want me just to stay here at the back?
Yeah. If you
Okay,
could,
perfect.
just so we can help him.
Okay.
What I'll do, Mr. Jacobs, is I'll support your leg while you move across.
Yeah.
You
Right.
you should be able to just move across. It's going to come around and drop your legs to the side.
Okay, so just shuffle across with my hands.
Mark's going to help you.
Right.
Um,
Okay, well, just be careful with that leg, Russell.
yeah. There you go, mate. There we go.
Just go slow, just go slow.
Okay. All good.
Oh, yes.
There we go.
Oh, just you got to be careful there. Obviously, he's just had surgery.
Yeah.
You need to support that leg all the way down.
Okay.
That was painful, Russell.
All right, sorry about that, Mr. Jacobs.
Yeah.
Are you okay?
Yeah.
All right, you got yourself settled there?
Yeah.
Okay. All right, just take a minute.
Okay, so Mr. Jacobs, we're going to start with these walking exercises.
With that bloody thing, isn't it?
Yeah.
Right, we're going to walk, are we?
Yes.
Okay. Bit tentative about that, Russell, I can assure you.
So we've got the frame.
Yeah.
Help you.
Okay.
So do you still want me to help, or?
Yeah.
So where do you think I'd be best to give you assistance? Do you think maybe around this side? Yeah, I would agree with that.
All right. So so Mark and I are going to help you to get up onto the frame.
Yeah.
Cool. So support your weight. There we go.
So bring your arms up onto the frame, elbows in. That's it.
There we go.
Okay.
You feeling dizzy or anything?
Yeah, just a little bit woozy, mate.
All right. If that gets any worse, then just let us know.
Probably because I've been lying down, I think, for a day and a half.
Yeah, it's pretty common after surgery.
Okay.
Is that settling down?
Yeah, it is. Yeah, it's
Okay,
clearing. It's
good.
clearing.
Okay. So
What's next, Russell?
I guess we'll take a step forward.
So whereabouts are we going? Where are we heading with this walk?
I just figured we'd take a short walk around and then come back to the chair.
Okay. Yep. Good.
Does it matter which leg I lead with?
I'd maybe try the operated leg, the left one.
Okay.
Yeah.
All right. Here we go.
Yeah.
Okay, so just be careful there. So you need to put your weight down through your elbows here to support that leg.
I was putting too much pressure on the knee, Mark.
Take as much weight as you need to through the elbows, and just take as much weight as you can through the knee.
Okay, yeah.
So did you check the sensation strength?
Yeah, I'm pretty sure. Yeah.
Yeah. Okay.
Yeah.
All right. We'll talk about that afterwards. All right. Off we go. Using those arms as much as you need to.
Just short steps.